Hello, and welcome to Connecting Hope. In today's episode, I will be talking with Dr. Chad Allgood of the Division of Early Childhood Care and Development. The Division of Early Childhood Care and Development helps families access the best possible care and education for their children, as well as supporting providers in the services of child care across the state of Mississippi. We hope the information that we share today will not only enhance, but equip you to better serve children and providers across the state of Mississippi. Welcome, Dr. Allgood, to this episode of Connecting Hope.
Thanks, Mark. Thanks for having me.
Today, I appreciate you joining us for our chat regarding child care in Mississippi, and specifically how the Division of Early Childhood Care and Development works to administer the Child Care Development Fund. So let's get right to it. What is the Child Care Development Fund, and what does it mean to children and families in Mississippi?
Well, bottom line, any family that has working parents, they need child care. And there are families out there that even though they're working full-time or maybe they're in school full-time, they still need a little bit of help. They need help with child care. It's very expensive. Child care tuition can take up a large portion of any family's budget. So the Child Care Development Fund, it's a pot of money that states are given that we use to help families afford child care. It's federal funding that comes down from the federal government. Each state gets a certain allotment of funding. It's based on a few different things. It's based on the number of children in the state that are younger than the age of 5. That's one of the things that goes into the formula, as they call it, that determines how much money we get. They also look at school lunches, which is kind of funny because we're talking about child care, but they still use the number of children that qualify for free and reduced lunches. And then they also look at what the state's per capita income is, as a whole. So all of these things come together, and there's a magic formula. There's a number that the state's given, and we use that money to support child care.
I think that's a misconception that, as is with a lot of the programs that MDHS administers, many people believe there's just this infinite number that we receive, but as you explained, there's a formula, and that number is kind of limited each year. And so the Division of Early Childhood Care and Development, I'll make sure I say that right. It's
got it right.
One of
That's
our
right.
longer titles in the division, but you must work within the constraints of that funding coming down from the federal government and the state.
That's right. And with that, with that money, there's always rules, right?
Yes.
Nothing is,
Yes.
nothing is free. When we do get that money, there are certain things that we're allowed to do with it. We have service percentages, as you will, that we're required to hit. I will point out that of the money, we're only required by federal law to use 70% of what we get for what we call direct services, which is child care tuition assistance. Mississippi is actually using 85%. And we do that, A, because the need is there.
Yes.
And B, because we're trying to ensure that that we can help as many families as we possibly can. As
I've gotten to know you, you just brought up something that we can kind of chase a little bit. As I've gotten to know you and your team, I've been impressed by the child and family focus of your work and your efforts to strengthen and enhance child care, but also to support child care providers to make sure that there is a program, and we'll get to some of those things that you've done over the last 4.5 years. But to be commended is the focus of children. I mean, that's in your first name in many cases, but congratulations for what you do, prioritizing 85% on direct services. Let's go in there because there's a dollar amount in there, but even more so a purpose by which y'all make sure that the division is administering those dollars.
So the people that are on my team, and that's everybody from those on the leadership team to those that work our applications to those that are doing training, all of these people, they're connected to a child. Just like, everyone is connected to a child. and they understand how vital our child care industry is. And so for them, it's not just work. It's a mission, and they do realize that what they do not only affects our clients, but it also affects them also. It affects their children. It affects the children that they're connected to. And so all of that, kind of comes together. And because of that commitment, we have seen the number of children that we've been able to serve increase dramatically over just the last couple of years.
I want to hit that.
Sure.
But within that, as you've started to serve more children, those funds, you talked about that funding module, hasn't astronomically or significantly kept pace with the number of children that MDHS is serving. So again, congratulations to your team. How have you done that? Because in a day of increasing costs and other factors that limit access to maybe some of these programs, your team has grown this program. And so hit that number, but let's talk about how y'all have maximized those dollars.
I would say probably a couple of years ago, back in 2022, we were serving on average around 22,000 children per month. Now we're serving, our last count, we are actively serving 34,000 children per month, which is, almost 12,000 more children than we were serving 2 years ago. How do we do it? Well, there's several different factors that go into that. First of all, we try to keep our administrative costs as low as we possibly can. Yeah. And we've tried to trim, like at our office, we try to automate as many things as we can. We've made a lot of improvements to our online application process. So the amount of people that have to touch those applications is reduced. Yeah. We have also done a lot to try to streamline the training support that our child care providers are receiving. Our trainers are working their tails off. They're in the field every single day supporting them. So trying to trim back those administrative costs is very important. But we've also tried to really partner with our child care providers in helping them understand what it means to provide the best possible care and education to children. They have a huge lift as well. And I feel like educating them, but then also allowing them to educate us on what their needs are and us trying to be as responsive to that. I think all of that plays into everybody just giving that little bit extra, which allows us to really tap into all the existing resources that we have to try to allocate as many dollars as we possibly can with what we get. So
to tag along that, you sent me some statistics, and I'll just share those. 70% of the money that we received, and again, I'm teasing a dollar amount, we're not going to hit there, but 70% must be spent on direct services. Right. As you mentioned earlier, Mississippi is spending closer to 85% on direct services, but there's some other requirements and percentages that you must spend some of the Child Care Development Fund on. So let's touch a little bit on those. You've already mentioned partnering with child care providers, but also those are some of those are part of the funding mechanism that you have to reach out and touch.
Right. So with the money that we receive, we do have the 70% rule. In addition to the 70% rule, we have to spend 12% of our money on what's called quality improvement activities. And the reason that the feds require quality improvement activities is because it's a fundamental tenet of the Child Care Development Fund program that any family, regardless of their socioeconomic status, have access to the best possible care and education for their children, high quality early childhood education. And so we are required to use 12% of what we get. And then of that 12%, we actually have to focus 3% specifically on infants and toddlers. It's important to use that money wisely. Yeah. And it's important, I mentioned us educating child care providers and families, but also letting them educate us. We've done a lot of work to try to really open the window of communication with our families and providers. We do a lot of what we call town hall information sessions, where we listen to child care providers, we listen to families about what's working, what's not working, And we try to use our quality money as strategically, but also as smartly as we possibly can, being responsive.
So Chad, let's speak dollars. Specifically the amount that the Division of Early Childhood Care and Development receives each year from the state appropriation through the legislature, the federal funding cycle, as well as kind of some grants that you administer, maybe they time limit in 2 to 3, 4 year periods, as well as any remaining COVID-19 related dollars.
So the way that it works with our federal allocation, the federal government has a formula for every state. And we get a percentage of what's called the Child Care Development Fund, which I think I've mentioned before. Yes. So Mississippi, for this year, we received $129 million. That's the combination of federal dollars and state dollars. Okay. Of that, about $6 million is state dollars. And now we are required to appropriate a certain amount of money to draw down our full federal allocation, which is where the $6 million in state funds come from.
So that's our maintenance of effort state match.
Correct. So we are required to do a maintenance of effort and matching. Every penny of our state money goes for direct services. We don't use that for anything else. The federal money that we get also goes for direct services, and then we also offer other support services for early childhood education, just to make sure that our parents are getting the best possible care and education for their children. So that's our regular federal allocation. From the pandemic, we did receive quite a bit of federal funding, relief funding from different pieces of legislation. There was the CARES Act, then there was the CRSA Act, and then finally the American Rescue Plan Act, which was the biggest bulk of the funding that we received. In total, we got over $700 million in combination of those different pieces of legislation. And we used all of that money to directly support child care. Yes. We did a variety of different things. Again, we expanded the number of subsidy vouchers. So we're serving more families now than we ever have. And a big reason for that was because of the additional funding that we got. We also invested a lot of money in the workforce, in the child care workforce. We provided bonus incentives to teachers that were working very hard to continue to care for and educate these children. We also provided scholarships for teachers. They could use that scholarship money to get a credential that's specific for early childhood education or to get their associate's degree. We also have expanded just the in-service professional development that they receive. MDHS has made a very good decision to allocate the maximum amount of our TANF funding that we get. We're allowed by federal law to allocate a percentage of the TANF funds that Mississippi gets for direct services for child care, and we are using the total percentage allowable.
There's not enough time to get to all the questions that your statements are actually creating in my head, especially you mentioned, and within that quality coaching, that training, usually as we've seen, as entities have automated some of their workflows, the more disconnected they have become from the customer service or even the clients or customers that they serve, the fewer touch points. In many cases, by freeing up some of that, using some of that automation, you've freed up staff to do just the opposite.
Right.
Another statistic you gave me, talking about your training workshops and your on-site coaching sessions. I think you know those numbers. So let's talk about those, but also how that training affects Mississippi's long-term capacity to educate and retain children from education.
So yeah, I think we've tried to automate where we should automate things that need to be automated, but at the end of the day, child care is still a human service function. And I think to properly support that, we can't lose the human service component of the support that we're giving to our child care providers. And so it is important that we have people out in the field that are going to child care providers, that are providing training, that are providing on-site coaching. We've done pretty well, I will say, with that number. Just in 2024 so far, which we're just in July, so we're a little over the halfway mark. We've already offered over 1,600 training workshops. Now that's when what you would think of it like a traditional training. Folks come, in a classroom setting, or sometimes they're done virtually. But over 1,600 of those, and then we've also done over 3,300 on-site training sessions, which is where we have someone that actually goes into a child care program and works side by side with the teacher and with the director. And let me stress the importance of the side by side component.
Yes.
It's important that my folks, when they're out there in the field, that when they're out there working with child care providers, I tell them all the time, you have to respect what these programs are doing. No two child care programs are alike. No two children's needs are alike, and we don't want to lose the specialization that these programs offer. We don't want to lose the expertise that these teachers have, because no one knows these kids better than the teachers and the directors in these programs. And for us to properly support those programs, we've got to listen. Like when we go in, it's important that our folks, ask the director, what are the issues that you see? I'm here to help you. What are the things that you see that we need to work on? Same things with the teacher. So it truly is a partnership. Like we say, our parents are our clients, our child care providers are our partners. So our parents are the clients that we serve. Our child care folks, they're our partners in helping serve those clients. And it's important that we not only respect what child care providers are doing day to day, but also respect the perspective that they have on the CCDF program and how we can constantly evolve it to better meet whatever their needs are.
I like that focus on customer service, but also recognizing that the people in the trenches that are serving parents and children every day are partners.
Right.
And it's coming alongside, not leading or dragging someone from a point of authority. And so I appreciate all that you're doing. And there's so much more that you guys do. And again, I keep on teasing this dollar amount, but the way the conversation is kind of leading me, DECCD does some amazing jobs. There's some other programs that you're offering within that funding context.
Right.
So it's not only the training. If I do it right, I'm not a mathematician, but you're coming in at about 8 training workshops a day. Mm-hmm. In the first part of 2024.
Right.
You're looking at about 16 on-site coaching sessions per day. Mm-hmm. And that's about, and correct me if I'm wrong, that's touching almost every provider during the year with some type of on-site coaching training based on the number of child care providers that are registered.
And that's the goal. That's the goal. Any of our providers that are out there that want the help, that need some support, that want to be involved, we want to provide that to them.
So we'll stop there and give a chance for you to pitch that program. If there's a provider that's listening or an advocate in a community that may have a new economic development program or has struggled with a child care desert, and that's one thing we'll talk about either in this episode or the next one, they're wondering how they can connect their child care industry in their community to these quality controls or quality supports, not controls, what would they do?
The best thing to do is going to be to find their local resource and referral site. We're also about to, we have 4 mobile resource and referral sites that are getting very close to hitting the road. And if you go and you visit one of these resource and referrals, or we call them R&Rs, kind of like when you hear R&R, you think rest and relaxation.
Yes.
Well, with the R&R, it stands for resource and referral, but it's also a place for anyone that is connected to a young child to come in and receive some support. When you go in, we hope that they find a very restful, peaceful place, a fun place to be. And these are support hubs for our early childhood field across the state. People that go in, they will see games, learning toys, books. Teachers can make things for their classroom with these resource and referrals, but also with these resource and referrals, they will find staff there. Like if you're a family if there's something that you need, whether it is childcare or if it's something else. You know, you need help finding a job, or you need help navigating to other support services that might be in your community. These resource and referral sites are where you should go. You're going to find staff that are going to help navigate you in the right direction. You're also going to find a connection to early childhood specialist, training specialist, if you will, that can help with, like, if you're a parent and you have something going on with your child, we have folks that can help you with that. Or if you're a child care provider and you need help setting up your classroom, or if you're a director and you need help setting up your budget, we have folks that will help you with that. So the best thing to do is, of course, to find your local resource referral. And the easiest way to do that is to go to our website.
Yes.
You go to mdhs.ms.gov, and you navigate to the Early Childhood Care and Education website or site web pages, and there's a resource and referral tab. It's easy to find, and you can type in your address, and it will show you whatever your closest resource and referral is.
So along those lines, Dr. Allgood, you mentioned the sites across the state. How many do we have? And then what have you done over the past few years? Because I think even as recent as 2022, that number was
low.
Mm-hmm.
Historically, we've had about usually between 16 and 17 sites. It's for the whole state. We have 82 counties. Yeah. We have, using a portion of the funding that we've gotten and realizing how important it is to have these hubs in as many communities as possible, we are dedicating more of our quality funding to expanding the resource and referral. Like I said, we've had historically about 16 or 17. Right now we have 28, with the goal of hitting over 50 before the end of the year.
Hence the idea of you're moving and creating more because they need to be closer to where the parents are.
Right.
The mobile R&Rs, that's kind of one of your babies, one of your brainchildren out of your team. Talk about those and where they will primarily be working.
So these will be, when I say mobile, they will literally be rolling resource and referrals, rolling R&Rs. We are working with Mississippi State Extension Service to outfit 4 transit vans with the resources and all of that. These mobile resource and referrals will go out to those even more remote areas where there's not a stationary R&R site. Very rural areas, and there will be a schedule that they'll follow. The plan is they will hit those locations about every 2 weeks and on a rotating basis. And we will go out to communities where there are young children and where there are adults that are trying to serve these young children in a variety of different ways, and that's just another way that we can offer some additional support. Take the resources to people that can't necessarily get to the resources.
One of the things that I think impresses me about the resource referral centers is toys for children, developmental toys. And I'm not an expert in this, but I've been around a teacher for the better part of my life. When children are at play, when children are experiencing and touching, they're learning. Right. So one of I think the blessings that I see coming out of the resource referral centers that people may not avail themselves to is that they can check out, parents and providers can check out these resources. Plus, as you mentioned, making lesson plans and arts and crafts for their class and getting the resources there. Let's talk a little bit about that, because that's a powerful tool that's available.
So when you talk about educating young children, play is the essence of early childhood education. Young children, they have to explore, discover, they have to use their senses, and they can't do that if they're trying to just write on a worksheet or color a coloring sheet. It's kind of funny because even my mentors would say coloring sheets and ditto sheets, as we call them, those are ugly words. We don't talk about that. So providing high quality learning materials, toys, games that these children can use to enhance the environment where they're getting down, they're discovering they're discovering their surroundings, they're exploring through learning play, through educational play is important. And we provide all of those resources in the resource and referral site. That's the resource part of the resource and referral. And when you go in, they're organized by age group, they're organized by type of material, so it's easy to find. So let's say that you're a toddler teacher. It's easy for you to go in and find materials that are geared for toddlers. But even more than that, we also dedicate materials to children that have special needs. And so when you go in, you can also find materials for children that may have some sort of developmental delay or learning delay, because there are materials that are designed to support their learning, to support their development. So you can find all that, and it's important that we continue to offer those services.
I'm glad. I'm sorry. I hope I didn't interrupt, but we're going to have to probably do two to three episodes on this, because there's so much wrapped into what DECCD is doing. One of the things you mentioned is those developmental resources for children that may have developmental disabilities. That's not where it stops. The R&Rs also have the ability to move people about and help child care centers and providers as well as parents with that resource as well.
That's right. So, I mentioned the resources, but I also mentioned the training. Yeah. Mississippi, we're very fortunate, because one of the things that we have the Mississippi Early Childhood Inclusion Center, which is at the University of Southern Mississippi. They've been a longtime valued partner of this division and of this agency, and they offer exclusive training for working with children who have special needs, but both for parents and for child care providers. We also offer free developmental screenings through them, all free of charge. Those are done at the resource and referral sites. If it's discovered that a child may need a little bit of additional support, they can help route that family to the proper early intervention services that may be necessary. And yeah, it's all designed to be holistic in nature. Yes. So whoever comes into a resource and referral, or whoever contacts this division, or whoever contacts any of our partners that we have out there, I've mentioned a couple, yeah. There's several others that are out there. Anybody that taps into that network, and that's why we call it a network, whether it's a parent, a teacher, a grandparent, an aunt, an uncle, or just someone that wants to know more about how young children learn, they're going to get directed in the right way for whatever their needs are.
I do want to hit something, because we're going to be back in a couple weeks with another episode talking with some providers, but also talking about the growth that you've done using some one-time dollars and collaboratives and relationship building through that. But you mentioned we're using roughly $107, $109 million to serve roughly 34,000 children a month. And you add that up each month. Child care is a very expensive proposition, not only to fund and sustain and equip centers, but also to provide the services to children that are quality. And I believe when you start looking at that, what you guys are doing, y'all have been able to maximize and do some of the expansion work with some one-time dollars. Let's touch there, and then we'll start segueing into next episode. But you've done some powerful work using, over the past 4 years, some COVID-19 money.
The pandemic was a horrible thing.
Yeah.
And there was a lot of loss there, yeah. Absolutely. One of the good things that did come about because of that terrible event, yeah. was we did receive some one-time, historically unprecedented amount of funding for early childhood education. It started with the CARES Act. It continued with a couple of other pieces of legislation. The most recent was the American Rescue Plan Act, which was the largest investment in early childhood education. And we did several things with that funding. It began with sustaining child care.
Yes.
Because child care was classified as an essential business. You had folks that could not shelter at home because they were working in hospitals, or they were working in food service, or they were working in garbage collection, or they, all of these different services that had to continue. These were working parents that could not shelter in place because they had to get out there and serve, continue to serve society. And so we started, but the problem was childcare also was taking a hit because there were families that were staying at home. And so the money began as an investment to keep childcare from completely tanking. When the pandemic was probably at its deepest, Mississippi lost all but 30, well, not lost, but Mississippi childcare programs, all but 30% of our childcare programs closed their doors, whether temporarily or permanently. We didn't want to lose those that were closing. And some of them were sheltering in place because they were doing what they needed to do to keep themselves safe, to keep their families safe. And we wanted to also support them in that. And so the money began as a way to sustain childcare. But as we continued through the pandemic and as we started to sort of see a little bit of light at the end of the tunnel, the money was still there. And at that point, the money became not just sustainability, but about taking childcare to the next level, because we knew it may be a long time before we saw this amount of money again. And so we started to think through, okay, how can we implement this funding, put some supports in place that are going to be sustainable over a longer period of time, but then also can address some of these real issues that childcare has seen. The first thing that we did was we launched a grant program called the Childcare Strong Grant Program, and it was designed to, again, sustain those childcare providers. We actually dedicated over $350 million that went directly to childcare. That didn't go anywhere else. It was actually $355 million that went directly to childcare programs. And then after that program, we launched a few other things with some of the additional money that we got. We partnered with Wonder School, which is a company that has helped us to develop the first ever statewide substitute teacher pool exclusively for childcare. Your K through 12, they have a substitute system. A teacher's sick, they've got someone that can step in. Childcare doesn't have that. There's a lot of infrastructure that's missing at supporting childcare. Substitute teachers, it seems like something simple, but it's not. And so the substitute teacher pool has been something that we've been able to offer, which has been monumental in helping. It helps childcare providers, when a teacher calls in sick, there's someone that's there. That person has already gone through all their background checks. They've been oriented at basic child development. So they're not going to go in and tape a child to the wall because, they're acting up, whatever. Which has been fantastic. We've also, because we did lose some childcare programs, but it also helped us to really, it gave us a moment to pause and look at where in the state we need to strengthen our childcare industry. We need more capacity. And so we realized that there are certain counties where there are more children that need childcare than there were actual childcare slots. And so we've also launched some training on starting up a childcare program. Also done through Wonder School, and along with that, we're offering startup grants to those programs, whether it's traditional child care or some folks care for children in their home. So that's family child care. So we're also supporting that. And with those training programs, we're trying to target more services specifically for infants and toddlers because we have a lack of infant toddler slots. Children that have special needs, that's always something that we could use more support for. And then extended care hours for parents that work third shift, et cetera. And again, we're trying to focus on recruiting in those childcare deserts, if you were. In addition to that, we've done some other services. We launched a teacher bonus program. Turnover has always been a big issue in child care. And so we have issued bonus payments to over 6,500 teachers in the state of Mississippi. They're receiving this bonus incentive. So far, we've paid out over $38 million just to teachers. And that's getting money in the hands of those that are making the biggest impact on these children. Would you like me to keep going?
One of the things that my mind is boggled at the scope of what you guys have been able to do. And we're talking, yes, large amounts of money, but we're also talking about, we're going to talk about partnerships a little bit deeper in our next episode. But one thing I think our audience needs to understand is it's expensive, but it's also time consuming to get quality childcare workers. It's not that you just go off the street and go to someone and say, come work. You mentioned the background checks, the trainings, but also availability, willingness. And so that substitute teacher pool, having that available, goes back to the heart of what you guys did in 2000, 2001 to first stabilize the industry. But even on a day-to-day basis, these substitute teacher pools, some of the other tools that you have created are stabilizing the industry, because if people can't go to work, Mississippi's workforce comes to a grinding halt.
Well, and that's the thing, yeah, we're out of the pandemic, but no one should get it twisted in that childcare is stable. Childcare is still a very delicate, very fragile industry. And childcare providers, our childcare, those that own these childcare programs, we ask a lot of them. Yeah. We ask them to take care of our most precious resource, our children, our babies. We ask them to provide not only care, but also educate these children. But we also ask them to do it at a price tag that allows parents to continue to afford it.
Exactly.
You're basically asking the impossible, because it is very expensive. We've seen the cost of everything go up, since the pandemic. And childcare is not cheap. It's not cheap to do. But the problem is, it's such a necessary commodity. Every working parent, every working adult that has a child has to have childcare to continue to work. And without our childcare industry, our workforce would fail. Yeah. It would fail. And childcare needs help, because again, when you look at providing these wonderful services to these children, it comes at a cost. Yeah. And childcare providers can't really charge what it really costs them, because if they did, parents wouldn't be able to afford it. And that's kind of our, that's something that we're seeing nationwide, as a real issue. How do we continue to build childcare? How do we continue to strengthen it? And to me, the answer is very, very simple. We have to invest. We have to invest in childcare.
So that speaks to kind of where we're going to come to the end of this first session on Connecting Hope. If there's one piece that we could leave our listeners today, the floor is yours, because we don't want to leave a touch point and somebody may miss the next episode. So the floor is yours. Give me something that's important to you want our listeners to understand.
I think back to my history with this field. It was an accident that I got into this field. It was not an accident that I continued in this field. And I have seen, in the time that I've been around, as I've moved from teacher to director to working in training, and now, at a policy level, I think the thing that resonates with me the most is when they say it takes a village to raise a child. It's not a joke, and it's not just a saying. It's the fact. It's fact. We are at a crucial pivot point with early childhood education right now. This field has finally received some of the attention that it deserves, and at this point, we can either continue to build on the momentum around this and really support this field to become what it has to be, or we can fail. And we can say, this is too complex, it's too difficult. But the question is, are you willing to bank on not seeing the right investment? Are you willing to bet the future on that? Because with childcare, we say that childcare is the backbone of our workforce. It absolutely is. But this isn't just about supporting today's workforce. This is about supporting tomorrow's workforce. What is more important to invest in than our future, which is our children?
So in the next episode, we'll not only have providers, but we're going to dig deeper into the impact that childcare has for our future workforce. That is one of the issues of childcare facing for the next century and probably beyond. I appreciate your time coming today. My head is spinning based on the amount of knowledge, but also thank you for the work that you do, the dedication that your team and under your leadership has brought to childcare in the state, because it's not just making a difference in this agency. We believe it's making a difference in the industry across the state. So thank you for joining us today. We look forward to seeing you in a couple more weeks for our second piece of this discussion about childcare and early childhood care and development in the state of Mississippi. Thank you for joining us.